One of the things that I spoke with your team about was prevention efforts. And once that drugs are already here in our communities, what type of treatment plans or prevention programs are you guys supporting that you think would best serve Americans once the drugs are already here?
Look, we are working as a whole of government. We have the Great American Recovery that is being led by Catherine Burgum. I'm very excited. Secretary Burgum's wife is leading that. We are all a part of that. Our office here at ONDCP, we focus not only on the supply side, which was the 48 kinetic strikes that we've seen already in Operation Southern Spear by the Department of War. We oversee all of the 19 agencies and the money that is distributed to those agencies to target the drug crisis. And that also includes the demand side. That means we have issues in the United States, not just with trying to find ways of delivering the prevention message so that it sticks.
Right.
And so that our children and our families have the tools necessary to fight back and to prevent our kids from ever using in the first place, but also for recovery and treatment. And recovery and treatment is just as important because we care about the American people. And when somebody is ready to go into recovery and treatment, we want them to be able to find that. And I've said this to you before, easier than it is to find drugs on the street.
Yes.
We've brought faith to the center of our national strategy. This is the very first time 83% plus of Americans believe in a power higher than themselves.
But that's interesting that you say that because I know people who have gone to treatment and one of the core teachings or what they do is they do go back to church or they have some sort of community.
Absolutely.
With some sort of spiritual aspect. So it's surprising that that wasn't something, I guess, up until now that wasn't discussed on a national level.
Yeah, it was a surprise to me too. It's almost as if we felt like we had to relegate church to some other place outside of government or recovery or treatment. No, 83% plus Americans believe in a faith and a God, something greater than themselves. That allows them and that helps them find recovery and treatment, gives them an opportunity to heal faster, to find something to put their burdens on that isn't just them carrying the burden alone, right? So we're reaching out to all of the communities across the United States, faith leaders. We had our first faith roundtable at the White House. And look, we're talking to the Catholic Church, to non-denominational. We had an imam. We brought in folks from LDS. So we're bringing everybody to the table and saying, how can we work to reach our communities, to better assist you in giving you the tools you need necessary? We have a chief medical officer here that we brought on board. We are working with Secretary Kennedy.
Yeah.
We have another roundtable with HUD and SAMHSA.